joining us today. I'm Dr. Anna York Bondoc. Our program is called Libreng Consulta, and we are live on YouTube and Facebook. So please like and subscribe po. Nagpapadagdag na kami ng mga sumusunod sa amin pong YouTube and Facebook. Today, it's a very, very interesting day because we are celebrating po World Hepatitis Day. It's a little belated na po yung celebration natin. It was July 28, but hepatitis, all of the variants actually of hepatitis are a big problem po sa Pilipinas, most especially hepatitis B. So sa mga concerned po sa kanilang atay, those who are worried about hepatitis B, want to learn more po about hepatitis B, please put lang po your questions below and we will definitely pick them up during our discussion. So let's start na po. Hopefully, you will watch us and over your lunch. And we are honored today to be joined by one of the foremost, if not the number one, transplant hepatologist po sa Pilipinas. I am very proud to say that he is my classmate, napakabait na tao, a very distinguished doctor. He is the one who really popularized po hepatitis B awareness po sa Pilipinas. He'll tell us more about his work. He's worked closely with the DOH and various government agencies. He is not only a gastroenterologist, a hepatologist, that's a liver specialist, but he is also one of the very few transplant hepatologists sa Pilipinas. Talagang when you see him, parang he's so humble. But anyway, I'm so proud to have him as my classmate. Let's greet Dr. Janus Ong. Doc Janus, kumusta ka na?
Hi, good morning, good afternoon na pala. Sorry. And thank you, Dr. Anna, for the invitation to be here on your show and on this segment to talk about hepatitis B or hepatitis in general. Thank you.
Ayan. Thanks, Doc Janus. For those who don't know, talagang pinakasikat po yan sa mga sakit na sa atay sa Pilipinas. So let's start, Doc Janus. For those with questions, this is your chance to ask the foremost hepatologist po ng Pilipinas. So let's go. Our case. Dear Doc Janus and Doc Anna, I am 30 years old and ang problema ko po is I cannot get a job clearance. Kasi po, I am a nurse and I have been told that I have hepatitis B or yung matagalan daw pong hepatitis B. So this is really stopping my career. I'm very worried also what will happen when I get married. So ano pong advice nyo sa akin? Dapat ho ba ako magpa-treat and is there anything I can do? So Doc Janus, anong advice mo dito if you saw this young person, bata pa and a nurse in your clinic?
Okay. Well, it's a very common scenario po, what you just gave. It may not be a nurse, it's any profession, no? Before I answer that directly, maybe I should just have told everyone that hepatitis B is a very common condition in the Philippines. From a study that we did, we estimate na mga 1 in 10 Filipinos have hepatitis B. And so that's a lot of Filipinos who have hepatitis B. So it's very common. So it's not unusual na meron po kayong kilala na o kamag-anak o loved one na may hepatitis B po. Kasi very common po talaga siya. Yung hepatitis B na pinag-uusapan po natin, yun po yung chronic hepatitis B. Meaning yung hepatitis B po na nandyan na sa katawan na hindi po nawawala. Unfortunately, kasi it has something to do with how the virus inactivates our immune system. So hindi po na-aatake ng ating immune system ang virus. So nandyan lang yung virus, no? Yan yung chronic hepatitis B, 1 in 10. So yung issue na binigay maraming issues yung kaso na case ni Dr. Anna, but yung first issue is yung employability. Mga around 12 years or 10 years ago, magkakasama kami sa Hepatology Society of the Philippines. Yung una po namin talagang proyekto or project was yung to advocate against discrimination in the workplace po. because kasama kasi ang hepatitis B for some reason po sa pre-employment testing. And what happens is pag positive, a long time ago, until now, I think there are other places that say na you cannot, eliminated na kaagad sa opportunity to work, which is hindi po siya tama. Kasi po, napakapili lang po yung mga trabaho kung saan pwedeng mag-transmit ng hepatitis yung isang may hepatitis. Kunyari, ikaw ay magtatrabaho sa office, o ikaw ay magtatrabaho as a carpenter, o ikaw ay magtatrabaho as a mekaniko. Walang kinalaman ang hepatitis status mo. Because hindi po ninyo matatransmit ang hepatitis infection sa ganoong trabaho and in that workplace. So, unang-una dapat hindi i-check. Kung i-check man po, yun ay dahil para alam lang niya kung ano ang kanyang sakit, pero walang kinalaman sa trabaho. Now, ano yung mga trabaho na meron pong konting restriction with respect to hepatitis B? So yun po ay nasa healthcare setting. Pero hindi dahil nurse, hindi na pwedeng magtrabaho. Kasi maraming trabaho sa nursing na hindi na allowed po, okay lang po ang may hepatitis B. Yun siguro mga nasa operating room na nurses lang po ang medyo will need evaluation and counseling po. Kasama na po yung mga surgeons, no? So sila lang po at saka yung mga emergency room doctors and emergency room nurses siguro. So those are the only occupations. Ang tawag namin doon, yung high-risk occupations, kung saan pwede pong mag-transmit ang isang healthcare worker. So aside from those occupations or positions, job positions, wala na pong need for restricting work sa kahit sinong gustong magtrabaho na may hepatitis B. Yun po,
Ayan.
Ana.
Thanks, Dr. Janus, for telling us about the job description. So, paano siya nagkaroon ng Hep B? How do you get Hep B? Yun.
Well, yeah, that's a good question. Sa Philippines, kasi nga very common ang tawag sa atin endemic. We are hyper-endemic for hepatitis B. And usually kapag endemic, kagaya sa Pilipinas, ang main transmission ng hepatitis B ay mother to child. So, hindi po siya
Wow.
inherited kasi tinatanong din ng mga patients, namana ko ba ito? Hindi po siya mana, na-transmit siya during childbirth, no? So, doon po siya sa akto ng pagkapanganak. Doon talaga natatransmit. Kaya nga, I will put in a plug na kaagad yung if there's one thing that you should get out of a awareness raising for Hep B is the importance of vaccination at birth, no? And that should be within 12 to 24 hours of birth. Kasi that act, yung pong pagbakuna within 12 to 24 hours of birth prevents hepatitis B infection po ng infant. Now, bakit importante na hindi ma-infect ang isang newborn? Kasi po, ang likelihood po na magiging chronic yung hepatitis B, napakataas kapag ang infection sa newborn. 95% po. But if you are infected po as an adult, kunyari tayo, mga ganitong edad, no? Na-infect po ng Hep B, siguro po 5% lang ang nagiging chronic. Nagkakaroon ng sintomas ng hepatitis, pero hindi po siya nagiging chronic. So medyo nawala ako, but the way we get hepatitis po is through blood and body fluids, no? Blood and body fluids. So blood transfusion. Kaya yung healthcare worker po may risk po na matransmit at may risk na mahawa kasi may mga blood products po sila na na-expose to. Body fluids din po. Kaya nga po, it is also considered sexually transmitted kasi po, it can be transmitted through body fluids po, vaginal fluid and seminal fluid, no? So, so yun po ang ways that we get transmission. Pero as I said po, in the Philippines, ang pinaka-common is mother to child po, vertical transmission.
Ay, wow. Ang ganda ng sinabi mo, Doc Janus. I know about mother to child and sexual transmission, but I did not realize na yung mother to child pala, yun ang pwedeng maging chronic.
Yes, it's
Or more
must highly.
commonly to become chronic.
Yeah, kasi that's why we are endemic. That's why we have 10 million people with Hep B, is because we didn't really have a very good infant vaccination program before. So we were having a lot of mother to child transmissions. And all of those became chronic. So kaya, and we're
Wow.
seeing the chronically infected now, no? Now, as you see, a very good example is Taiwan. No, Taiwan is called, for Hep B, they are called the Hep, the miracle of Taiwan, because Taiwan
Wow.
instituted universal vaccination in 1984, very strictly. And now maybe what now, 2021, they now the rates of infection from the ages of 0 to 35 is now less than 1% in Taiwan. And that's coming
Wow.
from an infection rate po of about 10 to 15%. So that's why it's called
Matindi.
the miracle of Taiwan. They did it very well, better than anyone else in the world. Yeah.
Magaling. That's something to nice to know about. And it's an inspiration. Um, Janus, balikan lang natin yung pinaka-basic kasi marami naguguluhan. What is hepatitis? Ano, viral ba siya? And how would we diagnose it
Um,
ngayon?
yeah. Well, hepatitis, as the word, yung word na hepatitis does not mean virus lang siya. Inflammation siya, pamamaga ng atay. So ang pamamaga ng atay, maraming reasons. Merong hepatitis virus, no? Virus, so hepatitis A, B, C. Meron pa ibang virus, dengue virus can cause hepatitis. The flu virus can cause hepatitis, and the COVID virus can actually, SARS-CoV-2 can cause hepatitis. So any virus actually can cause hepatitis. Pero very popular yung ABC kasi sila yung talagang nagbibigay, very common na nagbibigay ng paninilaw. Tapos yung hepatitis B and C nagiging chronic, hindi nawawala sa katawan. Kaya sila very important hepatitis viruses. Now, other reasons kung bakit namamaga yung atay, yung alcohol, alcoholic hepatitis that can also cause pamamaga ng atay. Hepatitis pa rin yun. Pero alcohol ang sanhi. Meron pa, fatty liver hepatitis. So if we are overweight, if we have diabetes, we don't drink pero we get hepatitis also. So yun ay iba pang hepatitis yun, fatty liver hepatitis. Basta pamamaga pa rin ng atay. Ano pa po, meron pang autoimmune, yung sarili nating immune system, ina-attack yung ating liver. Ano ba ang example ng autoimmune disease? People probably are more aware of lupus. Yung lupus po, buong katawan yung ina-attack niya. Yung autoimmune, liver lang. No? Autoimmune hepatitis, liver lang. Medications can cause hepatitis also. So yun po, anything that causes pamamaga ng atay, yung pamamaga ng atay is hepatitis, and there are many, many causes. Isa lang po yung hepatitis virus, yung hepatitis B and C and A.
Okay. Doc Janus, tell us more specifically about hepatitis B, since ito yung pinaka-common ata sa Pilipinas, am I correct?
Yes. Well, we
Oo.
have.
Tell us more about the
Oh,
hepatitis B virus. Ang balita ko,
okay.
someone told me this, na sobrang nakakahawa daw ang Hep B. Please tell me about it.
Well, nakakahawa siya because many people have very high viral load. Yung viral load po, yun yung amount or number of virus sa ating dugo, no? So, compared to hepatitis C, napakadami nung virus ng hepatitis B sa dugo compared to hepatitis C. And nakakahawa siya because yun nga, very high yung viral load. And but there are ways to prevent infection, as I already mentioned. Yun po yung timely birth dose vaccination. Yun po yung word, timely. timely because it's within 12 to 24 hours and it's a birth dose up at birth po. And that should be given within 12 to 24 hours. And then sa mga adults po na hindi pa na-infect at wala pang antibodies, pwede din po silang magpabakuna. No? In fact, recommended na magbakuna kasi nga very common ang hepatitis B sa ating bansa. And hepatitis B, yung chronic, can cause liver disease po. So yun po yung main complication ng hepatitis B. So we haven't really talked about what happens when you have hepatitis B. You can get liver disease. And if it is untreated, it can become cirrhosis. And it can also lead to liver cancer. So yun yung mga complications that we don't want to happen.
Yun. Doc Janus, question: how does someone know that they have chronic hepatitis? Like,
Ah,
maninilaw din ba sila? Or how do we
okay.
diagnose the acute and the chronic?
Okay. Well, the acute kasi, kung adult na yung nakukuha ng infection, maninilaw talaga. Meron talagang symptoms. Parang trangkaso, muscle aches, low-grade fever, nausea, walang appetite. Tapos yung iba naninilaw. So, may symptoms, so matetest talaga. No? Pero yung chronic, karamihan ng may chronic infection, walang symptoms. Minsan nga, you hear about it being the silent killer. I mean, that's too dramatic, no? But it is very silent until it causes complications. So the best way to know if you have hepatitis is to get tested. And in our country, where 1 out of 10 is infected, I think it's safe to say that if you want, you should get tested. What the reason why I say that with some hesitancy is because I wish that if you get tested, you do get adequate counseling. Kasi minsan, um, it's like HIV. You don't just get tested. When you get tested, you need to know why you're getting tested. Tapos, after you get tested, you need to know what a negative means, and you need to know what a positive means. So what are the actions that you need to make after a negative test and after a positive test? So that to me is also very important. So that's why when we were working, when I was still with Hepatology Society of the Philippines, but that page is still very active. We created a Facebook page called Be Aware, so that we can give information, several times a week, mainly on what happens. What does it mean when you're negative? What does it mean when you're positive? Aside from, of course, the advice to see a doctor if you can see a doctor.
Doc Janus, i-counsel mo nga kami. Gusto naming marinig kung should we get tested and what to do if we're positive or we're ninerbus tuloy ako. Pero ako na-test when I went to the States. Kasi doon ako nabakunahan ng Hep B. And
Yes.
I think all healthcare workers now are advised to be vaccinated for Hep B. So can you please
Yes.
counsel? Kasi 1 in 10 is so common.
Yes, it is. So the WHO actually has testing guidelines. They published that in 2017, and because hepatitis has become a priority, it is included in the Sustainable Development Goals, the SDGs, which replaced the MDGs, the Millennium Development Goals, and hepatitis is now specifically mentioned. So there are testing guidelines that they presented, and the WHO says that for countries like the Philippines, where it's endemic, everyone should be considered for testing. So, how do you counsel anyone? So, if somebody asked me, should I be tested? I would say, yes, you should be tested because it's very common in the Philippines and many have no symptoms. So, how do I counsel them when they come back and they say that I'm negative? Number one, I wouldn't screen just for S antigen. I would screen both for S antigen and antibody. So that isang tusok na lang. Kasi kung negative kasi yung test for S antigen. Yun yung test, no? By the way, the screening test is HBsAg. So if that's negative, that means wala po kayong infection. So what next? What next is meron ka na bang antibodies, no? Oo. So kung wala kang antibody, yun yung anti-HBs. Kung wala kang antibody, then it is advised or recommended that you get vaccinated kasi you live in the Philippines. Even if the likelihood na ma-expose ka sa blood and body fluid na infected is not very high, but because it's so common, it is recommended to consider vaccination. Kung negative ka sa HBsAg, walang infection, at negative din sa anti-HBs kasi hindi ka pa immune. So, vaccinate, no? So now, for positive, kung positive, that's more important. Kasi pag positive, you now need to be evaluated. The evaluation is to evaluate whether or not the hepatitis has caused liver disease, and in essence, to decide whether you need treatment or not, because not everyone needs treatment. Now, the reason why I emphasize the counseling is because in the pre-employment setting, especially in the overseas worker clinics,
Oo, ang dami.
there is a lot of screening going on, but there is no counseling that's happening. So what happens is that when they test positive, they're just told to go see a doctor. Like I think majority, hindi ko nila lahat, no? I mean, people might start to attack me, but they can attack me. Um, uh, what happens when someone tests positive and they're supposed to go abroad? They will just say, you can't go abroad and go see a doctor. But you can imagine the recipient of that test that's positive and being told he cannot work, and now you go see a doctor. What will that person do kaagad? They will go to Google,
Oo.
and then they will see all the horrible things that's written about hepatitis B, because that's what you see, and so they will just be
Be
so
depressed,
they be depressed. They don't know what to
magpa-panic.
do. They don't know what to do. So that's why I really think that testing should be may kaakibat dapat na post-test counseling, because it's that way that we can actually make sure that people understand that having hepatitis B is having hepatitis B. It doesn't mean that you have a death sentence. It's not at all. Many people, in fact, maybe about 75% of those with hep B probably never know they have hep B, and they go on with their lives, and they die of something else, not of the hepatitis B, hindi dahil sa hepatitis B, pero kasama lang nila yung hepatitis B. Oo. Kasi walang nangyari, no? Oo.
Ang ganda. Doc Janus, thank you. I think our letter writer is one of those na na-screen kasi sabi nga niya hindi daw siya mag-job clearance. So, when, anong dapat nilang gawin? Pag,
In the
halimbawa,
Philippines,
pinalayas na sila dun sa clinic,
in
what to do? O, then they went to your
in
clinic. Anong gagawin mo, Doc
okay.
Janus?
Well,
Parang
in the Philippines,
napaka-devastating naman itong sinabi. Oo.
yeah, in the Philippines there is a DOLE advisory, but it remains an advisory.
Okay.
We have been fighting, not fighting, we have been lobbying to get hepatitis B its own anti-discrimination bill. Um,
Okay.
but it's that's been a struggle, and we're still working with whoever we can work with, to get a bill to protect hepatitis patients. So because there's a DOLE advisory, there is a DOLE hotline, that people who have experienced discrimination can call. And there is also, and maybe I should have asked, I should have recommended that we had the patient organization called Yellow Warriors Society of the Philippines. to be here because they're a group of hepatitis infected persons who have come together so that they can help each other with their plight. No, you know, so that organization po can help anybody who has experienced discrimination because they have helped many already. Through the hotline, through arbitration. Some of them have complained, no, and they have gone to court because it is a form of discrimination. So again, I think you just have to find avenues to get yourself heard. And as I said, the Yellow Warrior Society of the Philippines is more than a willing ear to listen to these. But I think the other thing na ginawa na ng Hepatology Society of the Philippines is we've also been able to talk to large corporations about hepatitis in the workplace. And so they're much aware now. So while they still screen, nagsiscreen pa rin sila, hindi na nila dinideny ang work, no? In fact, ini-embrace na nila. Pero yun lang, they ask them to be seen and be evaluated.
Okay. Yeah. Thank you, Doc Janus, for this. And hopefully, those who become positive from their test, makapaghanap pa rin sila ng trabaho. Kasi hindi naman pwede na wala na silang job. So, ang dami
Yes.
ho nating tanong. Yes. Miss Reina, first question natin.
First question from one of our viewers. I'm worried about the family toothbrushes po.
Doc Janus, nakakahawa ba kung merong siguro we should yung dating may hepatitis B at yung merong chronic hepatitis B, dapat ba nating paghiwalay yon?
Yung sila,
At sino yung
ipaghiwalay sa
nakakahawa?
bahay.
No, I mean, siguro people should understand that you can have Hep B but hindi ka na nakakahawa. Versus chronic, I don't know, dapat ba?
Okay.
I mean,
So, if
baka they
you
cannot
get...
understand that concept. Oo.
Okay. Kung na-infect ka, sabi ko nga, kung na-infect ka as a child, as a newborn, 95% chance na magiging chronic. So, magiging with you na yan forever. 5% mawawala siya. Tapos, magiging immune ka. Pero pag adult ka na-infect, 5% lang yung magiging chronic, 95% mawawala siya. So, immune ka na by that time. In general, immune ka na. Hindi ka na mai-infect ng hepatitis B. Kaya nga, dahil nga, para wala yung worry na baka ma-infect ako kasi wala ako tapos may household member na may positive, dapat magpabakuna. 'Di ba? In fact, yung pala, sorry, I'll plug it here na rin. Whenever I see a hepatitis B patient, I always tell the patient to tell their household members, their parents, their siblings, and their children and spouse that they're infected and that all of them should consider to be screened, and if they're negative and not immune, to be vaccinated. So that's part of the counseling as well. That happens after someone tests positive because it's mother to child na. It's vertical transmission more often than not. And if it's not vertical, it's horizontal within very close contacts in families. So that's why that's part of the counseling na mag-screen yung iba at mag-test. Now, let me go to toothbrush kasi conceivably, you can transmit Hep B in toothbrushes because Hep B does live for a while outside of the human body. However, I think toothbrushes should be very personal and that we should never share toothbrushes, whether we live with someone with hepatitis B or not. No, so I think it's just good advice to never share the most personal items where there is contact with blood. No, so that includes toothbrushes, razors, um, nail clippers. maybe, no. So I think the risk of transmitting is low, except maybe for razors, because uh, we nasusugatan usually, no, so may dugo doon. So but I think that if a good way to just avoid anything infectious is to keep very personal things very personal, no. So um, don't use other people's toothbrushes or razors. Yeah.
So kung
Now, I
merong
think the
may
other
chronic
question,
Hep B sa pamilya, Doc Janus, dapat mag-ingat yung mga ibang family members, ganun ba? Or you should
no.
vaccinate your
Um,
family members?
well, when someone is positive in the family, as I mentioned, mas maganda kung mas-screen lahat ng close household
Okay.
contacts to make sure na walang infected din, 'di ba? Kasi baka may
Okay.
infected din, no? Kasi nga mother to child eh. So in fact, I have a lot of family members. I have a lot of patients now when they test positive and then when they screen their siblings, half of them are infected, no?
Oh,
So that's why the first advice is to screen household contacts. If they're positive, they need to be evaluated. If they're negative, they need to be vaccinated if they're not immune. So then at least everyone's protected already. Now, in terms of what forms of interactions at home are at risk for transmitting infection, actually everything that we do at home is very low risk for transmitting. Hugging, kissing, utensils. We don't generally share. I mean, we do share, but it's the amount of virus in saliva is very very low. So we don't transmit Hep B in that manner. Now sexual transmission is different, and that is a known transmission mode for hepatitis B. And so I always also tell patients who are positive to have their spouse screen, and if their spouse is negative, to check for antibody, and if they are negative, then to be vaccinated.
yan. Ang daming issues pala ng Hep B talaga. At saka inuulan tayo ng tanong, so short na lang. Miss Reina?
Yes, from one of our viewers, breastfeeding po ba is dangerous? How about swimming with a Hep B positive person?
Hmm. Okay, so
Dalawang
breastfeeding,
tanong ata yan. Isa-isa lang.
yeah,
Sige.
sa breastfeeding, kung wala kasing break sa breast ng mother, walang skin breaks, hindi siya risk for transmitting the virus, yung breast milk, no? But I think all of that can be wala na po yung issue kung nabakunahan po yung newborn. Oo. So kaya dapat importante talaga
True.
yung bakuna
Tama
at
naman.
birth, no? Oo. So and then there is the WHO does not prohibit breastfeeding after birth. Okay? Even in a mother who's Hep B positive. Swimming with a Hep B positive person. Yeah, I don't
Hindi
wala pong
naman siguro
problema.
may chlorina
Wala
naman yung
problema
pool. Oo.
kasi yung pool naman may chlorine. Tapos po, unless may sugat na sobrang daming dugong na lumalabas sa sugat, I don't think there is a risk po. Wala po. Wala.
Ah, that's good. Okay. Thank you. Next question. So, bakunahan yung mga baby para makapag-breastfeed.
Yes po, that's the
Sige,
number
next
one
question.
message. That's the number one message.
Doc, naninilaw ba lahat ng mga Hep B? How do we know if we have Hep B?
Hindi po. Kaya nasabi ko kanina, karamihan po ng may Hep B, hindi alam na may Hep B sila. So nalalaman na lang pag nag-apply ng trabaho, nag-test. O yung kamag-anak, nag-test, nagpa-test sila. or nag-donate ng blood, nag-test, ganon, no? So how do we know? Sabi ko nga, dahil 1 in 10 Filipinos ay may hepatitis B, kung gusto mong malaman, magpa-test lang po, no? And then, uh, and hopefully po, ay may makausap kayo kung anong ibig sabihin ng negative test at positive test. Pero nasabi ko na po kanina, kapag ka negative, um, magpa-check po kung kailangan ng bakuna kasi hindi pa nabakunahan, hindi pa immune. Kung hindi pa immune, magpabakuna. Kung positive po, magpatingin na para po ma-evaluate.
Okay.
Maybe I can put a plug
Yeah.
kasi the government, the Department of Health, again, through all the work now from the HSP, has piloted a program for treatment, screening, diagnosis, and treatment of Hep B in Bataan. Actually, and also in some sites in Metro Manila. But that's going to be rolled out nationwide. The problem is COVID happened. So hopefully that rollout will happen. I think COVID has been just a tough thing to handle. But the Department of Health has programs ready po.
And one question, Doc Janus, ano yung rollout treatment?
Screening, diagnosis, and treatment. Yes.
A screening diagnosis. I think I saw a question about treatment. So, puntahan natin yun after the question.
Yeah.
Para malinaw lang, how do we screen? It's a blood test, right?
It's a blood test. It can also be a pinprick lang. A pinprick, S
okay.
antigen. Yes. So it can be a pinprick or a blood test. Yes.
Okay,
So,
next
Miss Reina.
Doc, nakakamatay ba lahat ng Hep B?
Hindi. Sabi ko nga, sabi ko nga kanina, mga around 20% will develop po yung cirrhosis o liver cancer. Yung iba po, they will have other things, other problems, heart disease, diabetes, ganun po. So hindi po liver disease. So kaya importante yung evaluation and follow-up.
Yan. Okay, Doc Janus, inuulan daw tayo ng tanong. Shorter pa. Sorry.
Okay. From one of our viewer, how to know if you have hepatitis? Bakit mayroong A, B, C, D, and E?
Okay. How do you know?
Ano ba siya? COVID? Parang COVID. Short lang, a lay explanation kung ba't may A, B, C, D, and E.
Well, iba-iba silang viruses talagang. Talagang iba-iba silang viruses. Yung DNA, RNA, yung kanilang genetic material iba. So kaya may A, B, C, and D. Ang importante lang sa ating Pilipinas,
viruses.
Different viruses. Ang importante sa atin, A, B, and C. So yung A, yun po yung sa pagkain. Yun yung sa pagkain, yung A. No? Hindi yun nagiging chronic. Yung B and C, yun po yung sa blood and body fluids. Yun yung nagiging chronic. So itong tatlo ang importante sa Pilipinas. How do you know? You get tested.
The blood test. Okay.
Yes.
Mas common si B kaysa kay C.
A lot more common. 10 million versus 500,000.
Okay, next. Natawa ko dito. Sige, read this, Miss Reina.
Doc, may liver transplant na ba sa Pilipinas? What's the cost kaya? How about sa government?
Okay.
The question is, Doc, natawa ko dito. Baka naman, typo lang, may liver transplant. I guess he meant liver. Though, of course, we want to transplant our husband and wife sometimes.
Okay.
Liver. Sige, tell us about liver transplantation, Doc Janus.
Liver transplantation, hindi naman yun kailangan ng lahat ng may hepatitis. Kailangan lang yun ng mga merong severe disease na sanhi ng hepatitis, no? So, meron na po sa Pilipinas, no? May mga nagagawa na po sa bata, sa adult, sa mga patients na may cirrhosis. Medyo hirap lang po tayo dahil po sa donor situation, na-mention ko na ito kay Dr. Ana. Pero meron po. Ano po ang cost? It's currently around mga 4 million po, no? Yan yung
For
estimate.
M.
But sometimes, yes po. And sometimes it can be lower. Depende kung it's very uneventful po yung operation. Sa government, wala pa po. But hopefully, we can set one up. Again, COVID happened. So, I think there were efforts na
Oo.
gumawa pero hindi pa po na take off.
Okay. So, yes, liver transplantation is happening sa Pilipinas. Ayan.
Yes.
Doc Janus, please explain why hepatitis is a sexually transmitted disease. Dapat ba itong itanong sa mga
Reyna?
partners? Can you hear me po?
Okay.
Yeah,
Yes.
narinig po ako na ni Doc Jun. Okay po.
Okay, so yes, hepatitis is sexually transmitted po, B and C po, no? Because it can be transmitted by body fluids po, vaginal fluid and seminal fluid or sa semen po, no? So kaya sexually transmitted siya kasi nandun po yung virus. Oo. So dapat ba itong itanong sa mga partners? Wow, that's very difficult.
Dapat!
Well, I think bakit hindi, 'di ba? No? Pero I tell my patients that if they have a partner, that they should tell their partner so that the partner can be screened, and if they are not infected, they should be vaccinated. Kung mahal mo naman yung partner mo, I think you can say it.
It's better to be honest sa akin. Oo. Maganda yan. Kasi
Dear
lalo
Doc.
na since it's 1 in 10. So if you met 10 people, one of them has Hep B.
Yeah, that's true.
Dear Doc, I am Hep B chronic and I am having difficulty getting clearance
Parang
for my
nasagot na ata nito ni Doc
Okay.
about
Next
clearance.
po
Ano?
tayo.
I think Doc
From
answered that. So let's ask here.
Yes, from Miss Jessica Tupas. Doc, we had patient before na naka 3 times na Hep B course of vaccination, yet the titer after vaccination is still 0. He's also a case of IBD po. Paano po kaya pag sakali tulad ng patient na hindi nagpipick up ang katawan ng bakuna?
Okay. Okay, very good question po. Siguro
1 second, Doc Janus. Before you answer that, can you tell us about the vaccine? Para alam din nila yung schedule at paano. Oo.
Okay. So sa bata, ang bakuna talaga 3 doses. At least 1 month apart, 3 doses po. So sa bata, may birth dose. Yun yung within 12 to 24 hours. Tapos yung susunod na dose, kasama na yun sa pentavalent vaccine na binibigay ng Department of Health. Kasi di ba sa bata, sa dami ng bakuna, sama-sama na sa isang needle para hindi masakit. Oo. So, ang nangyayari sa bata, 4 yung kanilang nakukuha before they reach the age of 1. Kasi birth dose plus 3 pa. Oo. Sa adult po, we give 3 doses din. No? Yung unang dose, 1 month later, and then 6 months later. So, yun yung dosing sa adults. Yeah.
Okay.
Then maybe I
Do
can
we
answer
check antibody titers? Corollary to that, do we check antibody titers for Hep B?
Well, it is not
After
recommended.
vaccination or after you've been vaccinated, go ka na. Oo.
Yeah, it is not recommended unless you are in a job or work na talagang exposed ka. So mga doktor tinetest. Oo, hemodialysis nurses tinetest. Pero for the general population, kasi it's a very effective vaccine, we generally do not check. But because
what about those who don't like the case?
Yeah, I mean, some doctors still check after they vaccine and then to see if they seroconverted. Ang tawag doon kung nag-convert po ba. Oo. So may mga 10% na hindi nagko-convert. Oo. Now, itong patient na example dito, mukhang may risk factor po siya ng hindi pag-convert kasi may IBD po siya. And IBD kasi is a chronic condition So anybody with a chronic condition can have less immunity or immunogenicity. Parang any vaccine po, kapag binigay sa isang merong
Oo, meron
chronic
talaga nga.
condition, oo, sa anybody na may chronic condition, mas mababa talaga yung chances na mag-convert. Anong gagawin? So ang gagawin, pwede pong bakunahan ulit ng second series po. Second series. Yan yung recommendation. No? And hopefully mag-convert. Kung hindi po mag-convert, then ayun na yun. Now, alam lang po ng tao na wala siyang antibody. So dapat ingat lang po sa exposure.
Yeah, I think
Tapos,
he has to be very aware and always use a condom when having sex. That's what I could tell him.
or for any exposure, pwede kasing bigyan ng immune globulin eh. So basta aware ka na you don't have an antibody and you have a known exposure, you can be given HBIG. Yeah.
Okay. Pero I would travel everywhere with a condom kung ako yung taong yun. Yun lang ang masasabi ko.
That's good practice anyway. That's good practice.
Yeah. Hello. Sorry, na-train ako sa US. Ganun talaga. Okay, next question. Maganda
Next
to.
question.
Sige,
Doc, who should be treated and with what?
Yeah.
So we have very good treatments.
Where is the treatment decision there?
Well, first of all, there are very good medications available. And they're not very expensive now. The problem with hepatitis B is that it's like HIV. It's not curable. We can't cure it. But like HIV, we can control it. No? And controlling it has very good outcomes. We can save lives, prevent cancer, prevent death, prevent transplantation. So that's just to say that we have drugs and they're effective and they're safe and they're not expensive. I mean, I can't say that they're cheap because they're not like 2 pesos or something, but they're not expensive. So who should be treated?
Pa rin. Kakayanin din.
So who should be treated? That's the next question because we do not treat everyone. So the people that we treat are those na meron pong evidence ng virus replication. So, chine-check po yung DNA. Yung DNA. Tapos, yung mga taong may liver disease. So, dalawa po. Dapat may liver disease. Paano nalalaman yon? Sa blood test po, yung SGPT or ALT na mataas. Sa ultrasound, meron pong liver disease. So, yon, liver disease na yon. Tapos, dapat yung virus mataas, yung DNA. So kapag may liver disease, tapos mataas yung virus, yun yung mga pasyenteng dapat gamutin. Yung iba po, kapag mababa ang virus, walang liver disease, hindi po yung ginagamot. Minomonitor lang.
And these are the chronic hepatitis patients. Tama ba kami?
Yes, we're just talking about chronic hepatitis kasi yung acute hepatitis hindi ginagamot, kusang nawawala. Kusang nawawala siya.
Okay. Kusang nawawala ang acute. Is there any way to prevent from acute to chronic?
Wala. There is none.
I didn't know that.
The best way is to prevent the acute vaccination. So an ounce of prevention is worth more than a pound of cure. Yeah.
True. Okay. Question, assuming you found out na your partner is Hep B positive, should you run screaming to your clinic or pa-test ka muna, don't panic?
Don't panic at all. Don't panic at all.
Okay.
In the Philippines, many of the young ones have been vaccinated. If you were not vaccinated, you were inadvertently exposed and you're already immune. So it is there's a more than 50% chance that you're actually immune if you're not infected. So don't panic. Just get tested and then decide from there.
Last another questions, Doc Janus. Ayan.
Kasama na po ba Hep B in the Philippines vaccination program?
Kasama po ang Hep B vaccination sa expanded program on immunization. Yung birth dose po is
Kasama
free
na.
po. Kasi may law yun eh. May law. May law po yung birth dose. And kasama po siya sa PhilHealth Newborn Care Package. So, dapat libre po yun.
Okay.
From Miss
So,
Anna
last
Leo.
few,
Yep.
pwedeng maging liver cirrhosis? Yes, the answer is yes, ano, but not
Yes.
all.
Not all.
Tama ba ako, Dr. Janus?
Yes. Yes.
Not all.
Not all.
From Miss Jubilin Goricho
So,
Maglangke.
para hindi maging cirrhotic, magpa-treat ka na if you have chronic Hep B. Tama ba ako?
Magpa-monitor, magpa-evaluate kung kailangan ng treatment o hindi. Yes.
Yes, pa-monitor and then kung tumataas or what, your doctor will advise you. Okay.
From Miss Jubilin Goricho Maglangke. Good morning, Doc. Ako po
Okay
ay
po ako
positive
sa Hep
B.
B. Nabakunahan
Pero
na ako ng
nabakunahan
Pfizer.
po.
Very nice question. Ang may Hep B ba pwedeng magpa-COVID vaccine, Doc Janus, and do you advise that?
Yes, absolutely. I think they should be. Wala pong reason bakit hindi magpabakuna ang mga may hepatitis B. In fact, we advise them to get vaccinated po. Tsaka nandun sila sa priority actually, no? So, for me, dapat po more importantly, dapat magpabakuna po ang mga may hepatitis B.
Okay.
Kahit anong brand.
So, I think
Kahit
that's
anong
about...
brand, no?
Okay, that's good. Any brand. So,
Yeah.
we've reached last question na. Ayan.
Yes, last 2 questions na lang po. Doc, dati po kaya nalaman na may Hep B ako kasi nag-apply ako sa abroad. Ang sabi ni Doc ko, pwede naman daw ako mag-abroad habang hinihintay ang certificate. Pero sa mga agency, parang ito ang number 1 na requirement na hindi ka papasa sa medical kapag meron ka nito.
Ayan na nga.
Yan na nga. Napaka-difficult na question na wala pong kasagutan, no? Kasi abroad kasi po, ang problem po ay yung pong tatanggap doon sa kabila. And then wala na po tayong masasabi po sa kanila. Kasi pagdating nyo doon, kunyari pinalipad po kayo papunta doon sa kung saan man yon, usually the Middle East po, kasi yun ang talagang may mga rules. Pagdating nyo doon, ite-test kayo ulit. Pag positive po, pauwiin lang kayo. So,
Yeah.
I have no words. I have nothing to say. I feel it's so discriminatory. Pero hindi ko po alam kung
Pero
saan po
ibang
yun.
bansa yun eh. Oo.
So that
It's another
is a problem.
country.
May isang ano lang, ang
Problem
isang
talaga.
yeah, one pakiusap that I have for recruitment agencies is to do the hepatitis testing at the start, not at the end. Kasi a lot of times they do all the requirements, they spend so much, ang dami na nilang utang, tapos sa dulo pa yung hepatitis test, tapos nag-positive sila.
God.
Ubus na yung pera, nagkautang pa sila. So I think that should be reversed. The hepatitis test should be at the start. So tapos na, no? Tapos na. Wag
mo nang daanan pa yung proseso.
Yes.
I agree. Since we cannot stop the foreign country from requiring that kasi hindi naman tayo yon.
Yeah.
Sana wag na lang wag nang pagastusin pa yung mga tao.
Yes.
Answer
Last
the question
question.
immediately. Yan. Okay.
Yeah, last question po from Ms. Jubilin Goricho Maglangke. This is gonna be our last po. Doc, kapag meron ka po ba nito, pwede pa po ba kami magpa-vaccine ng anti-Hepa B para mabawasan ang virus?
No. My answer is no. Tama ba ako, Doc Janus?
Yeah, no. Wala po. Wala. Hindi po. No? Kahit anong bakuna pa, hindi na po
It's too
mag-work.
late.
Meron pong therapeutic vaccines. Wala pa po yon. Pinag-aaralan pa yon. Pero yung bakuna na meron tayo, wala po. Hindi na po. Sayang po ang pera po. Opo.
So once you're positive and no vaccine can turn that around. The important thing is not to become a chronic. But kung Alam mo yung number one na na-pick up ko dito, which I was so shocked, yung mother to child and 95% pala. Tama ba yung rinig ko? 95% will become chronic.
Yes. Yes. Yes.
Oh my
Yes.
God, that's a
Yes.
disaster. Ngayon ko lang
No,
nalaman yun, it's stuck in
it
my
is
mind.
it is not a disaster because vaccination works. Um,
Yan. Tama
so
yun.
there's a way to prevent it. We just need to ask for it. And the reason why I say that is because it's still happening, and in fact, more common in the private hospitals that the vaccine is not given within 24 hours. So, kung ikaw ang
Bakit?
nanay, many reasons. I do not know if it many reasons, and but that's why I say that if you ang kung ikaw ang nanay, kaso medyo siguro groggy ka pa kasi nanganak ka lang no? So dapat ang
Kakapapanganak
tatay,
lang.
yeah. So it should be
Oo.
the father or the grandparents that will have to say to the doctor, Doc, nabigyan na ba siya ng Hep B vaccine? Kung ako po ang kamag-anak ng isang manganganak, tatanungin ko yan, nabigyan na po ba ng Hep B vaccine yan? Oo. Okay?
Oh my
Kasi po,
gosh.
that is so important. That is so important. It goes without saying in an endemic country.
Nako, ang dami kong na-pick up talaga, including demand for your Hep B vaccine pagkatapos kang mga anak.
Demand for it because it's free.
Yan. O kaya istampahan nyo na yung kamay nyo para ipakita nyo sa doktor. So, thanks, Doc Janus. Siguro yun na yung last words mo. Talagang nakuha ko na talaga yung message. If you want to just encourage people na lang para hindi sila matakot. Yan.
Yeah, but Hep B is very common in the Philippines. Again, thank you, Dr. Anna, for allowing us to be a part of this endeavor. And it always feels good to talk about Hep B, to raise awareness about it, because there's still a general lack of awareness. Anyway, Hep B is very common, but we should not be afraid of Hep B. If you are tested positive, I think you should just reach out. A lot of people, they actually they hide themselves. I did not talk about stigma. I am so sorry. I did not talk about stigma. So maybe I can have a few minutes about stigma.
Sure. Go.
There is a lot of stigma about hepatitis B. And I don't know why. Because in the Philippines, most of the transmissions, mother to child. What's stigmatizing about that? Wala po, no? It can be sexually transmitted, but when you get it sexually, it doesn't become chronic. So there is no reason to stigmatize hepatitis B, but it happens. It happens even in death, no? Sometimes, no? I know of some funeral parlors that refuse to embalm positive patients,
Merong
no?
ganon.
So,
Oh my
ganon in
gosh.
some places, no? So stigma is a problem, and because of stigma, patients who are not properly counseled, kaya kailangan yung post-test counseling. Yung mga hindi naka-counsel, nababasa lang nila, naririnig lang nila, they will never reveal na positive sila. Tapos, yun na lang, they will just be depressed all their lives. And I'll give you an example. So this is a college graduate, and then she learned about being Hep B during an pre-employment testing, and for 7 or 8 years she just she decided not to apply for work para hindi ma-detect. She just did other types of work, no? And then when she saw me, I guess on TV talking about it, she decided maybe she'll go to clinic. And when she sat down, the first thing she did was to cry.
Oh my God.
So 7 years of this pent up emotions about, what am I, what is this that I have, just came out, in that one moment. And that's not uncommon, this living with this stigma. So I think that's another message, is to, forget about stigma. Let the world know you have Hep B.
Huwag
I mean,
kayong
it's
mahiya.
nothing.
Oo,
Uh,
seek treatment.
so
Oo.
yeah, and stigma is so common. So wala pong kinahihiya po ang Hep B. So that's one. The other one is may gamot. So magpa-test, magpa-evaluate, at kailangan ng gamot, magpagamot. And then lastly po, bakunahan po ang mga babies po within 24 hours. Yeah. Yeah.
Okay.
That's it. Thank you.
Thank you so much.
Thank you. All right. Bye-bye.
Thank you. Salamat. Ang ganda ng usapan po natin talaga with Doc Janus Ong. I have been an internist for what, 25 years plus. Tanda ko na, no? But I learned so many things talaga today na hindi ko nalaman. Ikaw, Miss Reyna. Parang mahina po ata yung net ni Miss Reyna. I'm
Yes,
sorry. Miss
I've
Rains, did
learned
you
a
learn
lot.
anything ngayon about Hep B? Ako, grabe.
Madaming naging klaro sa akin basing from my knowledge on medical. Ang daming iba pagka nakakausap mo ang mga specialist, iba po talaga. Mas nai-explain ng maayos.
Yeah. Ako, I'm already an internist. My father had Hep B and liver cancer. But I still learned so many things today. At sa akin, ang tumatak talaga sa akin, number one, 1 in 10 of Filipinos has hepatitis B. Number two, it comes from your mom, okay? Not from your partners most of the time. So don't panic. Wala pong nakakahiya. Number three, dapat yung mga anak bakunahan ng Hep B because it is so common. Within hours of giving birth, I don't know bakit hindi binabakunahan ng mga ospital. And nininervous na ako about this, especially kung nabakunahan po si Benji ng Hep B. But it's something po that we have to know, no? It is common, hindi po siya nakakahiya. Kids should be vaccinated, babies should be vaccinated. And number four, people should be able to have jobs despite being Hep B positive. And number five, if you are worried, then you have to consult your doctor. Dr. Janus po is at the Philippine General Hospital. Napakahaba po ng listahan niya, the Medical City Manila Doctors Hospital, and is one of the foremost specialists po in liver cancer and liver diseases po sa Pilipinas. It is a big honor to have him. Sana po may natutunan kayo today. I certainly learned a lot. So sa inyo po lahat, thank you so much for joining us. Let us celebrate po World Hepatitis Day by being aware. And also by spreading po, kung meron po kayong hepatitis B, don't hide. Seek treatment kung kailangan po. And again, if you're going to have a baby, be aware po of hepatitis B and the hepatitis B vaccine that can save lives. Tama po si Doc Janus. It's not a disaster. What is a disaster po? Yung nahihiya and not consulting a doctor. And then again, what is a disaster is not vaccinating kids. It's free, it's available. And sana po, we also maging ligtas po ang Pilipinas po from hepatitis B. So sa inyo po lahat, very good afternoon. Happy birthday to Miss Kathleen. Hindi po siya natin kasama today because it's her birthday.
Happy birthday!
And thank you so much for joining us. Thank you so much, everyone.